Flo, I have the pleasure of welcoming back a favorite guest and our return guest, bringing another guest with him. So a little double trouble here, if you will. I'm here with Gary Druckenmiller. So let's get started with Gary. Welcome back to the show.
Thank you, buddy. Thank you very much. Great to be here.
And Gary, why don't you welcome our guest?
I'd be happy to. Robert Sundelius is our co-founder, and we'll, as we go through our introductions here in a second. But Robert and I are here today to talk about the next stage of consumer health. And Robert, why don't you go ahead and introduce yourself, and then I'll introduce myself.
Yeah, Jared, thank you so much for the invitation. It's a pleasure to be here. Robert Sundelius, a little bit background, 20 years in the medical care industry sector, 10 of those consulting nationally and globally. Most recently with Ascension Health. Coming out of COVID, I took an off ramp and started writing, doing a little soul searching. And we can talk more about that later, but that's what has led me here today.
Terrific.
Well, maybe,
Thanks, Robert.
I'm
Gary
we can even
Druckenmiller.
start with some of that. Yeah.
Yeah,
Give us the lowdown, Gary.
Yeah, good backgrounds coming into this one. Gary Druckenmiller, formerly a GM of consumer experience at Innovator. And prior to that, I was a founding member of one of the first CRM businesses for health systems, going back to 2009, 2010, I think, a company called eVariant, which eventually got sold to Health Grades. And Robert and I are here today to talk about the next stage in our life, because I think we're just kind of blending care of health and healthcare now seemingly into our full embodiment of our lives. We're both co-founders of the Human Flourishing Collaborative and our anchor product, Figgle. And we look forward to sharing all of those details with you today.
This is more than just a founder story. That's why I was glad you brought in some of the background, because there's a road leading up to where you both are
Totally.
today. Maybe I can even start with some of that, Robert, what you were sharing about some of the your own journey since COVID, and in terms of some of the, it sounds like there's some, I don't know, like insights or kind of turning points yourself in terms of what makes sense for you. I mean, anything you want to share about some of that, because I think that's going to help set up the rest of our conversation.
Yeah, I'd love to. I mean, who would have thought we would have lived through a world pandemic, right? COVID for me was a studio apartment in inner city Detroit for 40 days. The first wave of COVID, running the incident command for Ascension, Michigan, 16 hospitals, 26,000 team members. And I was co-incident commander addressing one of the worst hit cities in the country, Detroit, in that first wave. And quite frankly, years later, I'm still unpacking that. But two key lessons came out of that for me. The first is leadership does not equate to a title. We have folks with titles who aren't leaders, and we have folks without titles who are. And the second opposite side of the coin is that our medical care systems are fragile and are buckling under the weight of what's coming at them. And we've invested trillions over the past 5 decades in building these world-class medical care systems. And yet we live in a society where all of the fruit is moving in the wrong direction. More heart disease, more diabetes, more obesity, more lung disease, more mental health issues. So it struck me. I stepped back, started doing some soul searching, and actually just started writing on that topic. I ended up being published at the World Economic Forum, which was a stage for me to gain a little bit of light. I had folks starting to call me, World Health Organization, UN, Ministries of Health, Singapore, New Zealand, folks from the UK. And what I found very interesting is that we live in a global society where the trend lines of chronic disease and the burden on society is not distinct to the United States. It's a global issue, but it is especially impactful in this country. And I started asking the question, what can we do about that? And whether it's fate or serendipity, ran into this guy named Gary and then a couple other folks. And we actually have a commitment, Jared, that is beyond our lifetime. So we're a couple of founders who have no interest in building a unicorn to flip in 36 months. I'm interested in planting an orchard, planting a vineyard, where the best fruit will be realized by future generations. So what we're talking about, I'm talking about for my daughter, my grandkids, and my great grandkids,
Hmm.
where they wake up in a society with less societal pain, less economic burden, and more flourishing. That's what we're about.
All right, so that was a good call to dive into that right off the bat here because I want to talk about kind of where we are. I want to talk about the collaborative, but I want to start with kind of setting up the problem or problems that you just mentioned, and whether or not those are the exact things that kind of led to the founding of the collaborative. So we'll get into what the collaborative is exactly here in a moment. Um, let's talk about kind of what problems you're trying to address with this, and then I think that'll make sense in terms of like what is being created as a result. But yeah, like let's zero in on that. What's the problem here that we're looking to address?
Yeah, I'll take first stab, and and Robert's backstory. I'll mention is the backstory of all of our four founders, co-founders, in varying ways, and we all kind of come in with that sense of angst from different angles. We've got a scientist, a PhD nutritionist on as a co-founder. He's had struggles. We've got somebody else who's in Canada, a gentleman by the name of Chris, and he's been struggling in his own right. So we're all coming in with that kind of nothing has worked to the way that it should work, or we expect it to work, or what is right versus wrong. So the problems that have kind of arisen out of that have several, and you use that proper term originally, Jared, the root, and you hear the means family talking about it, Cassie and Callie Means, and everybody's talking about root problems in medicine and nutrition, and so we're at that same level from a diagnostic point of view and from a care of health point of view. Bring that up to one more. If we put the label of consumerism on that, or consumer health, the words have to become a little bit easier because the populace of the world don't really understand healthcare. And they really don't fully understand yet wellness and the power of wellness, because it's still considered kind of this, I want some kind of esoteric term that only a small portion of any given population have access to, which is entirely untrue. Couldn't be opposite from the truth. So there are four main areas, each of which could be their own company if you went at them individually, that we're going after all at once. So the first one is agency. So what that really means is, are you truly the CEO of your health as an individual at N of one? Meaning you control and wield all of your data. You can transact, and that means everything, not just clinical, wearables, apps, information you share out on social media, anything that has anything to do with your health. Do you fully control it, own it, have it stored, and can monetize it in a sovereign fashion? The answer to that almost unilaterally is no. And of course, it should be. The second one is literacy. So you heard me say, nobody really understands healthcare. If you don't understand healthcare or how to improve it and some of the basic vernacular, how in the world can you set a path for self-improvement for you? And even in a more extreme case, how about your family? Are you setting a good example for your kids? Noting that those generations, especially Gen Z, 70% of them would rather get their information off of the internet than their doctor. And rightfully so, because they can probably find it easier there to understand. The second one is then incentives. Nobody will do what they really don't want to do. And one thing I should just kind of sneak in here is that our property is a B2C property, 100 bazillion% out of the gate. Now, will it eventually find its way back into the existing conceptual past kind of system? Of course it will. But right now, direct to consumer the whole way. So you have to be able to incentivize an individual that in a way that is unique to them, not generally. Like everything out there today is general incentivization. No, I need to know you, the tool, the system, the AI needs to know you and your health parameters and health personality better than you do to provide just the right incentives for you, Jared, for you, Robert, and I will then also be different. And then the last one, and arguably the biggest, is that, the power of the internet's been an amazing thing for my career. It's been the entire backbone of my career. But it comes with a heavy hand. As a society, we are more isolated. We are more cut off than we ever have been. We shop at home, we surf the web, we do all of these things. We've created a digital caricature of ourselves that in some ways circumvents the natural character of ourselves, hence the word flourishing, right? And Robert uses this term like oxygen. You don't want a digitally flourishing life. You want a natural flourishing life, or at least some better variation of that. Social connectivity is the big one that we're really, really going after. And to try to find a way for people to connect with each other on a common goal of self-improvement, to learn from each other, and to perhaps even crack the code, and we'll get into this as we move along into the product side, to crack the code of people like you who are going through exactly what you're going through, regardless of what side of healthcare you're having your issues on. Today, that is impossible. Or I shouldn't say it's impossible. It's a real struggle. It's gotten a little bit better, but it's still a struggle because of, doctor privilege or physician privilege, and PHI and HIPAA keeps most of the most important stuff, or a lot of the important stuff, locked away. And it's contained within a few individuals' eyesight. So those are the four areas: agency, incentives, literacy, and community or social connectivity, all being tackled at the same time in one platform, in one ecosphere, for the betterment of humanity.
Amazing. Okay, so let's talk about, like, why hasn't this? It all makes sense, right? There are natural connections with each of those four problems, and all of them being tackled at the same time. When you mentioned social connectivity, for instance, you were talking about being able to connect with those who are going through what you're going through, but on any side of healthcare. So I would add, health, wellness. So not just things I'm going to see a doctor for, because that's just a fraction of the overall health and wellness choices and behaviors that we're going to. Okay, so I think we're aligned on that. So why hasn't the market gotten here, up until now, right? Like, I have some, I guess, some semi-informed point of view on that, but probably a little too cynical, honestly. Like, why haven't we gotten here? Like, what has almost everyone else gotten wrong here that you believe about the market, that you think, like, this is the time to start addressing these?
I don't think people have gotten things wrong. Our systems are producing exactly what they were created to produce. We have medical care systems that are fueled on societal illness and disease. And our medical care systems were created precisely as a response to injury, illness, and disease. And honestly, that's necessary for an equitable and just society. We have to have medical care. However, it is woefully insufficient. We have medical care systems that we expect to also keep us healthy. And we mix up the nomenclature. So we use the term health care. We really mean medical care.
Yeah.
So the care of health happens where I eat, sleep, live, work, play, shop, learn, worship, live every day. My chronic disease doesn't happen once a year in my annual physical. It doesn't. And most people spend less than 1% of their lives accessing medical care. And yet we've built no system to address the care of health in our everyday lived environments, because the economic engines of the medical care system are so excessive. Embedded industries that will not change. And we believe the only way to ensure that our medical care systems are sustainable is to make them increasingly unnecessary. And that's what we're doing.
Yeah. One, if I can just swing on that one a little bit for 2 seconds, just as follow up. We all got into healthcare, sick care, medical care to fix it. It is unfixable. Unfixable. So if you truly recognize that, what's next? And you heard Robert continue to use that word system. We need a new system to slowly start to replace the old, and not directly. Like you're still going to have a need for the medical system, but this begins to then blur into that next wave of, well, is the medical system really solving, coming back to those root problems? They're not. Chronic disease continues to rise at an exponential rate. Childhood obesity continues to rise. Childhood mental health issues continue to rise. Why are they not slowing down if we're spending so much money in medical care? There's just something's not lined up there. So this is meant to kickstart that system. And part of that exercise is being bold enough and brave enough to step almost fully away from it and create something so unique and so original and so new under that kind of guise. People don't know what they want until you show it to them, right? Which is something I kind of mostly believe. This is definitely one of those moments. And when they see it, they'll realize and they'll figure out, they'll try to understand how they've lived their lives without it. So that's the kind of separation that we're beginning to see here. And we talk about what they've gotten wrong. I agree. Robert's right. Nobody's getting anything wrong. It's just that's the way it is. We've been told several times in our mission and conversations like this, you guys are thinking big, but you can think even bigger. That tells us we're on the right track. Like almost to say, you're thinking great, but you're not thinking big enough. And so this is our Expedia moment. This is our Zillow moment. This is our Credit Karma moment. Industry busters. And what do they all have in common? Direct to consumer, simplify the model, make it easy for people to redirect all the troubled ways of doing it the old way into a new way.
I love. Okay, so you've been told that you can even think bigger. Okay, that's opening up some thoughts here. So let me go down a couple of roads here, because then I do want to dig into like what you're actually building and how it works,
Sure.
right? But it reminded me of the classic discussion of innovation versus optimization when you said you have to step out of the existing system, whatever incentive structure, to even look at what like how you can address any of these problems, because they are so big, they're so entrenched. So you can either try to innovate, address something differently, or you can try to optimize the existing system. And I have a hard time disagreeing with the sentiment that it's unfixable as it exists today. So I like this road. Okay, so that lends itself to the thought of, yeah, we can think even bigger. So okay, so just had to think that came to mind as you were addressing that. Let's actually dig into what you are building here. Tell us more about the collaborative. There are a couple of components to it, I understand. We'll talk about a life score and things, but let's back up. Like, what is the collaborative?
So the Human Flourishing Collaborative is the world's first public benefit corporation created for the sole purpose of orchestrating science, technology, entrepreneurship, and investment toward human flourishing. So as a public benefit corporation, we are not a think tank. We don't sit around a table and pontificate about ideas. We're a do tank. So our intent is to act and create this system, and thus our anchor platform, FIGL. As a collaborative, we're an orchestrator, we're a conductor, we're a gatekeeper. So we realize that this journey will only take all of us. And we also believe that every industry and every sector has a role to play. So the care of health is impacted by the real estate I live in, my zip code, the clothing I buy, the food I eat, the transportation I use, my financial status, my social connections. It's impacted by the technology that I consume and how I consume it. So everything is impacting the care of health. And yet we relegate that to a medical care system when it hits the fan. Our interest is inviting these industry sectors into meaningful commitment, meaningful action, and meaningful build in creating this care of health system at an N of one to scale to change our society and other societies. The wealth and security of a nation is the health of its people. We're going in all the wrong directions. And it's not one industry sector that is going to fix that. And it's not going to happen quickly. It's a long-term vision. So the Human Flourishing Collaborative is the hold co. It's the outside structure within which all of this orchestration, the conducting, the gatekeeping, the collaboration is going to happen.
Nice. Okay. So yeah, so let's talk about some of the components here. I've heard there's a life score that you build here. Walk me through that and like any other some of the offerings that are
Sure.
In the pipeline or being worked on right now.
Yeah. So so the life score, and we use that term generically. So what we call the life score, this is my marketing hat coming on, Jared. Strap yourself in. We call it your figure. Just like, so FIGGLE is PHI, wink, wink, GGLE. Your figure is PHIGURE. Trademarked, copyrighted. So your figure is a directionally accurate and comprehensive view of an individual's overall level of flourishing. So the first version of this, which is based in science, and that is an incredibly important statement to make. The engine driving this is a scientific engine written by a PhD who's been at this for a couple of years and basically says, without going into the layers, which I think we'll expose here in a second, well, I'll let it out now. So it covers the 6 pillars of health. So nutrition, activity, self-care, mindfulness, sleep, social connectivity. All of those are baked in. All of the data is baked in. And the life score takes from those subscores across those 6 pillars. So we're already scoring at the pillar level. And then those roll up to the single number because the populace of the world really just needs one number. Like your credit score, like your GPA, like your SAT score, like your Zillow's estimate. Just everybody's too busy. The populace is too busy to focus on all the stats. The 5 or 10% of the elite healthcare people, they got time to do that. They got the money to do that. The 90 to 95% that are metabolically unhealthy in America and probably the world don't have time to do that. They need easy buttons. So the figure integrates self-appraisals across the 6 pillars, like 5 or 6 questions each, right? Not like a health assessment, that's 90 pages long and you're ready to burn it by the time you're done with it. Select wearables and apps to start, but eventually it'll cover the gamut. And then other digital health data meant to supplement it, maybe claims data, maybe publicly available data from the CDC or the HHS, all kind of coming in to provide the most specific and N of one personalized health persona and caricature of you. These subscores provide the valuable and necessary insights into any individual in the world's life balance reflected in the singular and master life score. And it's meant to guide them towards areas requiring attention, improvement, such as diet quality, better sleeping, more routine, functional exercise, all of the above. They're weighted, balanced, and prioritized scientifically using a homegrown algorithm, a la most of those organizations that I mentioned before. That's how Expedia came to market. That's how Zillow came to market. But again, rooted in science with validated measurements and a way to display that in a UI that will be completely and utterly original and unique to the market. Nobody will have ever seen anything like this before. It all has to be original in order to be accepted. So the life score is the figure is the centerpiece to all of that. And then what flows out of that is everything that I kind of mentioned before. And you'll probably get us in there, but the things like the incentives and the literacy all kind of flow out of the ability to harness everything and hinge everything, again, for the populace on that single number rooted in science.
You know, the other thing I would add to that is, and Gary said it so well, but really we use this phrase, connecting the disconnected and making visible the invisible. So we're connecting you to yourself and to a trusted community, and we're making visible the impact of your daily micro choices in your unique environment on your overall journey to better in a very elegant, simple, sticky way.
So I hear there's an ecosphere involved here. What's that side of it?
So our Human Flourishing Collaborative and the care of health, as we mentioned, is impacted by everything. So the ecosphere is inclusive of products, it's inclusive of services, it's inclusive of relationships, organizations, journeys that impact your care of health, and it's orchestrated and conducted for the sole purpose of your journey to better. So what role does sport have in that? What role does the NFL, NBA, or Major League Baseball have? And they have a role to play. What role does retailers and apparel have in that? What role does food and what I eat have in that? And take it down another level. If I live in 49546 zip code, where do I get healthy food? And how do I find it? And how is that communicated to me without me having to ask for it? And how do I know that Fred, who lives around the corner, also likes the farmer's market, is also on a journey to better, needs to drop 10 pounds, and we can help each other along the way. So when we talk about ecosphere, we talk about a growing and evolving system that is touching every aspect of your journey in life and helping you connect that to your care of health and helping you visualize the impact of that in your care of health and do that in relationship.
Nice. Okay. So when I'll probably think with my own marketing hat here, Gary. So touche. We will, because I had some experience in this myself recently when trying to bring something kind of new or early to the market. So I feel like we're still inclined, whether by nature or whatever, or just training, we're inclined to still try to categorize things into an existing category, new product, new service, new platform, whatever. So, what I'm hearing is, and I like hearing this because I think this is the way we have to go. I think this is how big we have to think. I think in order to make any difference in any of the problems you've discussed, that we do have to think big. We have to think innovate versus optimize. So totally on board with this. So like, how do you describe that? Do you try to fit it into an existing category? I imagine you're still kind of early on all of this, but it's, I would guess both of you are similar to me in that you kind of wake up thinking about this kind of stuff, like how to bring it to the market and how to communicate it so people really see the value of it. Like, does it fit into an existing category? Because you're going to have this ecosphere concept. You're going to have the collaborative. You have, sounds like Figgle isn't the only thing that's going to come to market as part of this. So I guess it's more of a communicating the value of it question. This is where I've seen some other products and services that are truly innovative to me. They either have to figure this out or they're going to struggle to get some traction right off the bat of how to communicate the value of it to, because people are just like, is it like this other thing? Like, no, it's better than that. Anyway, just how do you tackle any of that part of it?
So to answer your first question, does it fall into any category? I'm happy to say no, it doesn't. It is, but it is the culmination, and as Robert so eloquently stated, connector and infomediary of pretty much all of them. So from wellness to medical care, I'll even say in some aspects to pharma, because I mean, we talk poorly about pharma, but there are some benefits to pharma. There are. Just
Agreed.
where they're just becoming less and less of them as time goes on, unfortunately. So whatever good is in any of those, and that is happening, we're serving as an access vehicle, an intermediary, because one thing that was supposed to happen, coming back to the COVID example, that didn't, was that all of the great work that was done to sanctify that deadly, horrific time in our lifetime, which we hope we will never see again. There was a lot of great work that came out of that. And in those kind of moments, what industries typically do is they standardize and consolidate on the best of that work to make sure it doesn't ever happen again.
Yeah.
Has that happened? No. In fact, it's gotten 1,000 times worse. We are fragmented across DRG codes at the startup level, subspecialties at the startup level, categories within wellness at the startup level. Some organizations are backing in. Large enterprises are trying to back in and pretend to be a startup. It's absolutely an utter insanity. And what's happening is that we're all jockeying for microbes of the industry. And who suffers when that happens? When you as an individual cannot get a consolidated view of what's happening molecularly, biologically, esoterically, physiologically, pathologically about yourself, who suffers? Jared suffers. Gary suffers. Robert suffers. Billions of people suffer because everybody's just trying to jump in and get their land grab and get out. Or stick around and wait for something else bad to happen. This could not be further from our mission and our model. And Robert mentioned we're a public benefit corporation. We have a responsibility to do good, to put right before wrong, common sense before inept logic or conceptual past logic. None of that applies here. So no, we don't fit into any category, but we want to serve as the master integrator for all of those organizations. There's some great ones out there. Function Health is doing great. You got hims and hers. I think it's plural. Hims and hers. Good organization, good intentions. So there's some good stuff that's rising up, but they're only looking at certain components of it, and there's a cost of entry that makes it hard for probably 80 to 90% of the population to say, I'm all in. So somebody has to jump and look way ahead, a decade ahead, which is what Robert and I and the rest of our crew are doing. We're looking a decade ahead and saying, what will it look like there? That's what this company is doing right now to ensure that the fragmentation and separation between all of these factions doesn't continue to compound on itself like interest. That has to stop. And it's not going to stop unless you put something in there that the populace can be like, that's the easy button I want. You guys figure out the back end. And if you can do that and serve as my one place to go and tell me and give me just enough direction to make me want to be healthier, like that's the trigger. Like people need to be shown something in a way that makes them want to be healthier. Like that I'm really using those terms carefully. And we don't have that. It's all try this, do this, new thing, new tech, cool. People are way smarter than that. They look for authenticity. They look for missions, especially when it comes to your life and to the life of those around you. So that's why we don't fall into a category. And we see what we're trying to do as be not the answer to everything, but the holding mechanism for all of these other companies who some are doing great work, some aren't, to find a vehicle to take their good stuff and get it to the masses in a distribution platform that will be second to none. And when we talk about distribution, Jared, we're not talking 1 million people here. We're not talking 10 million people. We're talking hundreds of millions of people. in one
Love it.
place, in a community where they can share publicly or privately their details related to their struggles or their positives in their life, where others can learn from it. That absolutely is almost near impossible to happen today at scale. This is where it happens. And this is where the code begins to get cracked for some of these chronic diseases in a way that doesn't necessarily require you to have to go into the hospital 20 times in a week. There has to be a better way there. And we think in our community, with everybody recognizing their life scores and trying to match up and see, what are you going through? What are you going through in a single place? Yeah, count me in. I'll connect with all those people. You probably have a story, Jared. I got a family story of some sort of chronic disease cutting through my family. Yep. And my sisters, I'm sure you got one. I know Robert has one. Everybody has one. But we can do nothing about it. Now we can.
Yeah, I mean, we have people today, Jared, and I mean, your podcast is going to go on for the next decade, because we have 350,000 health apps available right now. We have 3,000 just for diabetes. And in the United States, we rank order the top 100 diabetes management platforms every year. And we have more diabetes now than we ever have before. So we have an entire society that builds with a big sucking sound to extract profit from disease. We're flipping that script. Yeah. We're going 10 years ahead to say 10% reduction in chronic disease in 10 years. This isn't about treating disease. It's about avoiding it, keeping people from becoming patients.
Well, I'll tell you, there are two paths that we've talked about a lot on this podcast over the years, right? And I bring up a lot how the podcast has changed, the arc, the topics, the theme, the point of view, but it's all been informed by speaking with visionaries like the two of you, because that's where healthcare is headed. That's where health and wellness is headed. That's where as we all kind of learn from each other, we all start thinking more along these lines of, I have to think further out. I do need to think bigger. I know it can feel kind of like boiling the ocean, but I think, Gary, you kind of address that for me, of like, because I was going to ask, doesn't this feel like boiling the ocean? But I feel like what you're describing, this isn't a single point of addressing everything by creating a collaborative, by creating this ecosphere, by bringing things together that are already addressing some of these points and problems. You're not trying to tackle this yourselves. You are creating the place where a lot of this is going to happen. So I love that side of this story, because the other side of that is, where I was going with, why do I bring up the fact that, we don't talk as much about marketing as we used to, or things like that, because very first few episodes, we were talking a lot about digital marketing, but it's because we were still trying to address, look, we're at a hospital at the time. Peter, my original co-host, and I, we were both at a hospital. We're trying to address really how to engage people in their health, and some parts of that are good. Some parts don't even come close to making sense. And so it was a journey into understanding the incentive side. It was a journey to understanding what does the journey look like when we go upstream and understand the business of healthcare. Like, why aren't we incentivized to keep people healthy as much instead of just treating them when they're sick? So all of that to say, like, all of that factors in for me in terms of where the ceiling is here, because the ceiling is almost unlimited with what the two of you are describing. But I think that comes back to the types of partners you two are looking for. So I'm just curious, like, what kind of partners you're looking for. So sorry to cut you off there, Robert.
No, it is limitless. It's singular. It's hard to get your head around, right? So one of the things I'm doing right now is working on a book. The working title is Toward Human Flourishing, and it's filled with interviews. So I've got 2 or 3 interviews with CEOs from some of the largest health systems, and I'm not going to name this person, but in the interview, I asked this question: why don't you try and keep people healthy? And the response was very clear. It's because we weren't created to, we're not resourced to, we're not incentivized to. No hospital is incentivized to keep people out of the hospital. No surgical program is incentivized to reduce their surgeries. There's no cardiovascular program anywhere that is incentivized to reduce heart disease. And people are shocked by that. We have medical care systems that are incentivized to provide medical care. And yet we keep saying it's broken. We keep saying it's falling apart. We keep saying it's sick care. It's not broken. It is medical care. It is sick care. We have one system. We need two. And that's the thing that folks they can't get their head around that. Like, how do we create a system for the care of health? And what role does medical care have to play in that? We talk often about on-ramps and off-ramps. We will all need medical care in our lives. If I have a brain aneurysm, I want the world's best medical care. But that happens at such a small percentage of my life. And again, the chronic disease is everywhere else. And we don't address it, but we will. It's not been built, but it will be.
All right, so let me tie in a couple of, I guess, other sub themes of our show, especially this last season, right? And we were touching on some of these already, but we've looked at how traditional care can work with all these adjacent wellness preventive areas, everything from nutrition to sleep. Several of the ones you mentioned, the 6 drivers, fitness, nutrition, mental health, sleep, weight loss, which can be a category on its own, as we know now, and it's affecting health behaviors like unlike anything I've ever seen in my lifetime. With the emergence of GLP-1 and semaglutide offerings out there, it's changing the game of where wellness and prevention fits in and who offers solutions there. So I'm just curious, how do some of these preventive or wellness potential partners, how do they work with sick care, or do they even, I guess, like, do they need to work as much with medical care, or are we truly like focusing so much more on the upstream that the rest will kind of sort itself out?
Gary, before you take this, because I know you've got a great answer, I just want to touch on one thing. And even the way you said it, Jared, and I'm finding no fault with it, but where does wellness fit in? It should be just the opposite. Where does medical care fit in to a lifetime journey for the care of health? So we have to flip that script, because wellness doesn't fit in. It has to be central, and it has to be where we live every day in the 99% of our lives that impact the care of health. Gary.
It's so perfect. And it's funny, you mean, it's not funny. Well, it is sort of weird. We all come from the same base. We were all once provider. Jared dances very nicely between both. But we've all been there. And what's the phrase that we would always use? At least I know Jared and I did, because we're marketing guys. You're in your lifetime, you are 1% of that time a patient, and you're 99% not a patient. So think about what Robert just said. Now, why do we say, how does wellness fit in? Because the infrastructure and bureaucracy of the system has told us why. That's why. We're at the center of your world. That didn't just happen overnight. That didn't just happen because of COVID. That's been a 40, 50-year run. And that's why everybody thinks that way. And wellness is this kind of voodoo pixie dust kind of thing that I kind of understand. I kind of don't. Yeah, I got to watch, but I don't know. And why? Because you now are being directed to take personal responsibility for yourself. And people are, in some ways, probably afraid to do that, because the first thing they think of is, am I going to make my life worse? Am I going to make my health worse? Because the sick care system has been driving kind of a message into your head like, no, you need us. You need us. If we're not there, it could be bad. That's why everybody's number one, right, Jared? Everybody's number one at something. because they're fighting for that mentality on billboards and emails. And when I was red pilled on this 4 years ago, I just sat there and I was like, what have I been doing? So Robert's 100% right. It's how does medical fit into wellness? So to answer your question, anything in wellness right now, all they got is, as far as an infrastructure, is trying to find a way to get their tools into the current healthcare system. A majority of more comprehensive consumer apps, some might have a health score, some might have some really cool diagnostics, some might have this beautiful interface. They're not direct to consumer, like MyFitnessPal or Calm. They are still plugging into the patient system because why? That's where the fastest money is. That's how you become a unicorn and IPO. That's the model. And guess what's happening to that right now? It is literally going belly up. Last year, you saw a ton of startups burn out. They're gone. You're going to see another half of them who are just struggling with the resources they have. By the end of 2025, gone. So the mentality is go where the puck is. Start building to the industry that's coming, and you have to think more esoterically and more comprehensively. And that requires a different vantage point of people. They are not patients. They are your everyday common folk, white collar, blue collar, white, black, Hispanic, whatever, that are just trying to find the easiest way to maintain a lifestyle that allows them to wake up every day and feel good and make decisions that make their lives easy and efficient and frictionless. And they haven't seen anything like that yet. It's just more complication and more complication. So that jumping ahead now provides a beacon for anybody to look at and say, if I live there, I can now take a direct-to-consumer tool that fits in the Human Flourishing Collaboratives and FIGL's ecosphere, which means our desire, our intent is to create more startups, to incentivize new entrepreneurs to come in and create more tools, and more tools, and maybe not as fragmented as we want it to be, but to do things that haven't been done yet because this new world, this new system exists. And that's how the shift happens. And that's why you need an ecosphere to catch all of this and rein it all in. And some of those partners could be biometric organizations, facial scans, could be urine tests. And it's a debate that we have often. You've got consumer medical, and then you've got clinical medical, and you've got consumer clinical, right? So you've got a lot of tools that would once be considered heavily medical in nature that are now starting to bleed more advantageous to just consumers doing them themselves. And we're right in that mix. And those are the partners we're looking for. So it's blurry right now, but we're trying to avoid the blurriness and put that beacon out ahead that people can start to say, I can live there. If I don't want to live in the current system, I now have a new home. I'm going to build something that's never been built before. I'm going to help the farmers. I'm going to help these psychiatry services, these local health services. All of them now have a new place to call home. And so that's the shift. And it's not one that's looking towards the past. It's one that's looking a decade towards the future.
And some of it is blurry, but this is what is not blurry. And it's very critical to hear this message. Human flourishing is not a luxury. It's our most authentic identity. And I shouldn't have to pay $500 a year to get it. It's not a luxury.
That's right.
I kind of want to end there, but I also have one more question for the both of you. So that's the perfect place to wrap here. But
he'll say it again.
Okay, good. That was powerful. It really was. and maybe that's where I can wrap, because I usually like to ask is what gives people hope for the future of healthcare. I think we would tweak that to say what gives you hope for our ability to flourish uh,
Mm.
in this country moving forward. And I think that was, I don't think I could put it more beautifully than what you just said, Robert. So maybe I can just end with, if there's a message that each of you could share, I'll give you each a turn on this. If there's one message you could share with health consumers, whatever we want to call ourselves, we're all trying to navigate in some ways the health and wellness journeys. And I might be changing my way of describing that, because this truly is a journey of flourishing. Uh, so health and wellness are parts of that and aspects of that, but we're attempting to tie in a lot more pieces to it to understand that bigger picture. So if you could share one message with people who are just looking to navigate, they are looking to flourish with their lives, they're figuring out their health and wellness choices as part of that. So what message would you share with people based on what you're building and just your own point of view? I'd love to hear from each of you.
Robert, please go first.
It's interesting. The message that I would share is that life wants to be lived. It's not so much we're creating something new. We're actually taking the posture of a sculptor, right? Take away, take away, take away, take away, until the most honest, beautiful, impactful, and elegant vision is left. And we have become so ingrained in these embedded systems that it's so difficult for us to see a better way. And it's critical to take away the message that life wants to be lived, and we all can participate, and it's not a luxury.
Uh, it's so simple. It's that sentiment. It's almost scary. And I mean that in a good way. The part of our exercise isn't just building some stuff. It's trying to persuade a significant amount of people that what they have inside of them, in terms of their ability to flourish, in terms of their ability to self-heal, in terms of their ability to engage with others who look like them or don't look like them, but might be going through similar life ups and downs that they never knew existed. And to not have the fear to go after that with every ounce of their vigor, if not for themselves, then to set a good example for those that will come behind them. This is a psychological exercise in humanity's ability to thrive in ways that we once took for granted and have now lost complete and utter sight of. That to me, coupled with everything that Robert has so eloquently stated, is the real true meaning behind this mission. The outcome is that we have to build something to make that accessible and affordable for everybody on the planet. So, yeah, I think we are attempting to boil the ocean for a consumer, direct-to-consumer good and idea and mission. And guess what? It's required. And only the most courageous and boldest people with an extensive vision that scales beyond the footprint of their natural lives would be crazy enough to do this. Somebody has to. And there's a lot of stop signs for a lot of things out there that we need to shut down medically and again physiologically and so on. And the ultimate message for anybody who sees this and wants to be a part of it and join us on this journey. And I look at Cassie and Callie Means. I look at some certain maybe factions of our government and other high-powered individuals who are out there influencing the world. Let this be a new beacon for you to rise into, and allow people to all people to thrive, not just a portion of them. And that's a mission, Jared. It's not a business. It's a mission.
It truly is. This has been a pleasure to have you both here to really set us on a trajectory here that we will be hearing about again. Let's have you back on periodically. Let's check in on where things are, how things are going. But thank you both so much for joining me today.
Thank you. Appreciate it,
Thank
Jared.
you.
And cut.